Good afternoon, everyone. Thank you very much for joining this afternoon's webinar. My name's Andy Sherritt from IT Health. I'll be hosting today's session. We're here with Imprivata to talk about patient privacy, which I'm sure is going to be interesting for all of you. Very quick bit of housekeeping from me, just to say that we would very much appreciate your questions as we go through. You should be able to post these in the questions box. I'll monitor this and we can tackle those at the end of the session. Also, we will be giving you a quick survey, which we'd appreciate you to complete at the end of the webinar. So in terms of who the panel of speakers are today, as I said, I'm Andy Sherritt. I'm the head of business development here at IT Health. Most of you will know me. We do have a last minute substitution with Dan Johnston coming in for Claire, but I'll let the rest of the panel introduce themselves. So over to you first, please, Andy.
Hi, thanks, Andy. Not to make things very confusing, but yeah, my name's Andy Wilcox. I'm the Senior Product Marketing Manager here at Imprivata.
Over to you, Tyler.
Yeah, good afternoon, everyone. Tyler Carlson. I handle all things sales engineering here at Imprivata FairWarning.
And finally, Dan, not Claire.
Not Claire. I won't be as good a stand-in as Claire, but nonetheless, my name is Dan Johnston. I'm equally a clinical workflow specialist with Imprivata, and I'm also the clinical safety officer within the NHS.
Thank you, guys. Before I hand over to Andy Wilcox to get into the meat of the session, just very quickly on IT Health. We are NHS IT security specialists, so I'm sure all of you know that. We've got a portfolio of solutions and services that are all geared towards NHS cybersecurity, compliance, assurance. We've hopefully built up a fairly good reputation for that over the years. We select our vendor partners very carefully. So you can see on the screen there, we work with a number of leading technology vendors to help to deliver those kind of cyber solutions into the NHS. A lot of you will be familiar with our assurance dashboard, which is powered by Landsweeper. We also have our remote access solution for the NHS, which is widely used. Today, though, we're very much here to focus on the Imprivata solution set. IT Health and myself personally have partnered with Imprivata now for, I'm going to say, getting on for 15 years. So it's a long-standing partnership. We very much value the partnership and rate very highly the technology, and the FairWarning acquisition is definitely a positive step. Enough from me for now. I'll hand over to you, Andy. I'll just pass you the controls.
Thanks, Andy. Yeah, and just say it's great to be here. I mean, as you said, Andy, we've been partners for many, many years, and I think the relationship and the way we work together is just fantastically complementary to the market and the NHS. So yeah, it's just great to come and join you today. Topic we're going to talk about is patient privacy, and I wanted to kind of do a little bit of scene setting in talking about how control of getting access to patient data that we need to ensure is made private, it happens, and how digital identity relates to that. And it used to be really fairly simple in the old days, a few years ago, where the digital identity that a clinician had, a small number of clinicians had, was inside the four walls of the hospital, and the clinicians were accessing data using thick client workstations, thick client applications, and it was fairly straightforward to control within those kind of constraints of what we were doing then. But we've moved forward massively in the last year, in the last 10 years, and we're starting to see a huge number of different roles and users access and be given access to patient data, not just within the four walls of the hospital either. So, within the organisation, users can be out on the road, they can be in remote clinics or even working from home. And we're also, with the kind of the STPs and the ICSs occurring, we're seeing more users from outside of the individual organisation needing to be granted access to data and information inside the individual organisation or the individual hospital. And that also means that the devices that users and clinicians are accessing that data on are becoming more and more varied. So thin zero clients are very, very commonplace now. We're seeing lots more things delivered via mobile device, whether it's things like e-observations or remote consultations. The move to working from home has necessitated opening up to personal devices, given access to the patient data, and also things like connected medical devices, which are both reading and writing data directly into our clinical systems. And we moved well beyond the traditional thick client app into the cloud applications that run on the desktop. But as a result of all those new devices that we're accessing, we're getting things like mobile applications and web applications. And that's creating a huge amount of complexity around digital identity, which is the fundamental thing that governs what we as a user, we as clinicians have access to, and what data we can see. And so looking at the Imprivata Digital Identity Framework and all of the different areas that identity touches, it's very fundamental that we have that unified view of how identity is used within the organization. From over on the left-hand side, where we're considering things like governance and administration, so what we need to be compliant with, things like GDPR and NHS Data Security Protection Toolkit, through to how we get users onboarded and we manage them through their time in the organization as they change roles, change responsibilities, and then how we offboard them when they leave the organization. And then when we've onboarded them and got them into the organization, how do we control what they can see and what they can access and what they can do with all of that data that we're going to give them access to? And then finally, as we get to the right-hand side, we're thinking about how we actually enable clinicians to use all of those systems efficiently and effectively. And today we're going to be talking about the patient privacy aspect, which is the Imprivata FairWarning solution. Now that sits very much on the left-hand side and is focused very much on how we manage, how we look at governance, administration and identity and access, and how we know what is happening within our organization with all of those things. So many of you probably know Imprivata from our historical products, our single sign-on solution. More recently, we've been on with IT Health and talked about our identity governance solution, which manages the joiner, mover, leaver process, all very much more on the operational end of things, how we enable users and grant them access. Also, much more up-to-date solutions that we've just released, like our virtual smart card, which enables NHS users to get rid of the clunky physical smart card and just access all of those spine-enabled applications without needing to find a card, find a reader, plug it in, type the PIN code in. So all focused on end user benefits. But today we're going to talk about FairWarning, which is very much focused around how we monitor all of those aspects and ensure that we're protecting that patient, the privacy of that patient data. So kind of just expanding on that, I mean, identity governance deals with how we get people on and how we define who can do what within the organization. Then OneSign, which you're all very familiar with, controls how those clinicians, the kind of when and where aspect of that, what they can do, what they can access, when they can access it and where they can access it. And FairWarning is that it gives us that next layer on, which is the what is happening, what's going on inside the applications, who's doing what when they're actually logged in. And that can help with, it can give you that view inside the applications itself. It can help you manage, risk, mitigate risk, and ensure that you're creating a culture of good behavior, and also ensure you've got all the right tools to support the drive for compliance. And I know, apologies that the slide's got US references on here. What we're talking about here is things like GDPR, NHS Data Security Protection Toolkit, Cyber Essentials, all of those things that you have to be compliant with day to day. So that's kind of an introduction to why FairWarning's joined the Imprivata stable, and is a fantastic addition to all of the tools we've already got. What I'm going to do now is hand over to Tyler, who's actually going to talk you through the FairWarning solution in more detail and kind of give you a demo about that. So Tyler, you ready?
Absolutely, thank you, Andy. All right, and so Andy, I think you had a great explanation of kind of why this makes so much sense as far as FairWarning joining the Imprivata portfolio. So now I'm going to jump into kind of some more detail on FairWarning. And so, really, if you take a look at the healthcare delivery environment and ecosystem of today's day and age, you really start to see why it's so necessary to have monitoring and have proactive monitoring when it comes to patient privacy. And the image that we have here really kind of spells it out. I mean, we have so many different ways of access, so many different people accessing. It's not just one workstation inside of our hospital that's accessing patient information. It's now really everywhere. And so we've seen security and compliance teams spending weeks, if not months, just obtaining data in order to do some type of investigation into, maybe it's a data breach, maybe it's a security incident, maybe it's just a patient complaint, maybe it's just a patient inquiry. And so with FairWarning, we really developed a platform that takes weeks, if not months, and turns it into really the click of a button in a few seconds, which really saves our customers lots and lots of time. Now, on our next slide here, what we'll do is we'll cover a little bit of kind of the why this matters. So Andy, if you want to click next for me there. There we go. So really what it comes down to is insider threats in healthcare. So FairWarning is very focused on monitoring internal employees, internal staff members who are your insider threats. There's a lot of fantastic tools out there that monitor for external threats, but there's a whole lot less focus on internal threats. And if you see my statistic here, in reality, 48% of healthcare breaches are caused by insiders. So everybody's devoting a lot of effort, a lot of time to monitoring for those external threat actors, but there's not nearly as much going into monitoring for insiders. And again, almost 50% of the breaches that occur are caused by insiders, whether it's on purpose or on accident. Now, as you can kind of see our image here, with FairWarning, we're monitoring for things like data exfiltration. So when we talk about large scale breaches, and we'll get into more detail about this a little bit later, but when we talk about large scale breaches, being able to monitor for data that's leaving your environment, and it doesn't have to be your EHR exclusively. It can also be applications like Microsoft 365. Do we see an export that happens in your electronic health record and then an import into SharePoint or OneDrive? Well, now we've got patient data that's out there that can be accessed anywhere. Probably don't want that. Now, we're also looking for things like unauthorized access. So who has access to your system or is accessing your system that maybe shouldn't? Now, it also moves to things like snooping. And then what we're seeing in a lot of volume here in the States, and I think it is starting to expand out into Europe and elsewhere, is drug diversion monitoring. So how do we monitor for the dispensing of medications, the movement of medications throughout your organization? Now, we go ahead and click to the next slide here. And this is really just some examples of kind of in-region, some fines, really, some kind of financial penalties that have occurred due to non-compliance. And really, FairWarning is geared towards helping our customers comply with the many regulations that are in place and new regulations that are coming into place that are even more strict than there ever have been. And if we take a look at some of these numbers here, if you take a look at the fine numbers, these are not small. These are numbers that if you have a tool like FairWarning in place, you're certainly going to benefit when it comes from a cost perspective to mitigating a fine like you see here. And again, these are just a few examples of the very, very many penalties that have been handed down across Europe. Now, on our next slide here, we'll talk a little bit about how it works. So essentially with FairWarning, what we're doing is we're aggregating data across all of your different systems, and we're bringing that data in, spinning it into a human readable format, and then we're using technology like machine learning and AI to both understand the data and then also to detect certain types of behavioral patterns that can indicate inappropriate access. So instead of, again, having to do a human review, or we're looking through an Excel spreadsheet of data, we have technology that can do all of that for us. And since we already have all of the data in one location, we're also minimizing the time it takes to respond to something. So as you can see, it's both proactive and reactive. We have the ability to look back in time, use that AI technology to look back over time, and then we also have the ability to use that technology proactively so that we prevent things from happening, or we find them immediately when they do happen, which again obviously saves our organizations from risk, as well as saving time. Now, Dan, I do want to pass it over to you for a minute. I know that you definitely have a lot of kind of color that you can add here to this piece.
Yeah, sure. I liked your comment about the means or having the tools to make the interpretation of all of this data readable, because I think it has real implications to not just IT, but to operations staff and information governance colleagues throughout organizations. And then that obviously leads into department managers and clinical leads as well. So, and as an ongoing clinician, as an emergency department nurse and a former ops manager and nurse manager, you inevitably get involved in these investigations of looking at how data is being interpreted, who's accessing it and where, and unsurprisingly, over the years gone past, as things have become increasingly more digital, being able to understand who was where and how information was accessed can be quite a bewildering, protracted kind of process, which obviously can have implications for either patient inquiries or family members, as well as colleagues and investigations. And obviously we could be managing quite sensitive topics in terms of patient health information, that the sooner it can be efficiently addressed and managed and evidenced, and most importantly, transparent, then providing that mechanism or those mechanisms to provide that level of integrity to the data is really important. So offering that transparency to not only the operational and the department managers, but also to fellow frontline clinicians as well, taking them on that journey can be really important in terms of finding means of reflecting on certain behaviours, some of which might be undesirable, but also some of those, we're talking about behavioural change as institutions and organisations become more digital. So they become points of reflection and also a point of learning, of which by having this level of transparency, you can take an organisation on in terms of advancing data governance and data integrity, really, and leads to effective clinical governance, really. But I know that you're probably going to take us on to some cases where that's relevant. So I might hand back to you, Tyler.
Perfect. Yeah, it's a perfect segue into our next slide here, because we're going to get a little more granular now and talk about some of the different risks that FairWarning really monitors for our customers every single day. So these are all different use cases that our customers are monitoring day in and day out. And some of them are known risks and some of them are unknown risks. Now we'll start with our known risks. And these are things that really all of us are probably familiar with. These are things that, quite frankly, we know are happening probably every day in every organization. And with FairWarning, we proactively monitor and flag these different accesses. So it starts oftentimes with more basic scenarios like snooping. So who is looking at their coworkers' records, maybe their manager, neighbors, family members, VIP individuals, whether it's just well-known individuals in the community, or maybe it's well-known individuals across the world. We're monitoring for that snooping day in and day out. And that really helps us get a culture of compliance, a culture of privacy within our organizations, because these are the things that are occurring most frequently, even though they are the maybe lower end of the risk spectrum, they're the most frequent. And so being able to monitor for these day in and day out is really key when it comes to establishing that culture. Now, it then gets more advanced from there. So it could be monitoring for things like inappropriate record modification. So do we have people who are maybe committing fraud? Maybe they're editing or canceling. Maybe they're deleting things. We want to know when that happens, and FairWarning can monitor for that. Now, from more of a security type perspective, data exfiltration is hugely important to monitor. Individuals exporting, taking data with them, putting data in places that we don't want it, that poses a risk. These are the reputation damaging breaches that we're monitoring for here with our data exfiltration analytics. Now, it also gets into things like access by terminated users, but also individuals who are maybe inactive, maybe they're on leave, maybe they're third parties that shouldn't still have access. Monitoring for that access is obviously key. And then lastly here on our known side is compromised credentials. So FairWarning can actually monitor for individuals who have indications of compromised credentials. So maybe we have simultaneous logins where you have a single user credential logged into multiple workstations across the organization, or maybe even in different locations. That's very key to monitor for. Compromised credentials is one of the #1 ways that individuals are stealing data. Now, on the unknown side, I want everyone to think AI here. So this is really where we're applying our artificial intelligence. And that's kind of what we mean by unknown. These are things that they don't necessarily pop up in a rule-based analytic. This is something where we need an advanced technology that's able to crunch more data than a human can in order to pick out things like abnormal workflows. So this is something that maybe in an Excel spreadsheet wouldn't look abnormal to the naked eye. And we need technology like AI to crunch that data, to compare more data than we're capable of doing, and then let us know that there's something going on that we need to pay attention to. And that's where AI comes in. We can also look at things like access by non-care team individuals. So who is accessing a patient record when they shouldn't be, because they're not a part of that care team or don't have any relevant reason for accessing those patients. And then the last one that I'll touch on here is access by affiliates or by third parties. So if there's access that's coming in to your specific medical records system by individuals who shouldn't have access, or maybe individuals that should, but then they're misusing that access. It's not justifiable in the way that they're using that particular access. That really is a key use case for AI as well. Now, when we're considering these use cases, Dan, is there anything that you wanted to add here from kind of the clinical side of things?
It was really just to echo your initial point on this slide, is establishing that culture of essentially trust as things, as systems or as our working practices become increasingly reliant upon digital processes. And there is so much more, especially in healthcare, where so much more is now recorded in digital systems. Establishing that trust is really is paramount, and it's kind of it moves also to a culture of privacy, whereby we're all learning what does it mean to manage data and personal health information. And I think we're all of these systems and professions are learning how significant this data is and how important it is to keep it secure. So, but also at the same time, keep it fully accessible so that patient care and treatment can be provided. And with that, also certain assurances need to be provided. And I think tools such as Imprivata FairWarning offer that means in which that trust can be provided and assured. So it's just a
absolutely, Dan. I think you hit the nail on the head there.
Right. Yeah. I'll hand back to you, but it's what I often see is how the culture is being supported so that that assurance can be provided, most importantly to patients, but also to colleagues too.
Perfect, perfect. All right, and so Andy, if we want to go ahead and advance to our next slide here. This is a little kind of a quick overview of what FairWarning provides our customers from kind of a high level. So, we've talked through each of these different pieces in at least some detail, but this kind of puts it all together. So our customers are taking advantage of our AI applied analytics and behavioral analytics. They're also taking advantage of our dedicated expertise. So at FairWarning, we really are the largest, most advanced platform in the entire world. And so what that means is we have the most expertise, we have the most data that we can learn from, and our customers really benefit from that expertise and from that data volume. Now, what I'll also show you here in our demonstration here shortly is our investigation module. So FairWarning has an investigation module that's built right in. So you don't have to have a separate tool, a separate platform when it comes to documenting the potential incidents that FairWarning is uncovering for you. So think full life cycle here. This really ensures that you have everything that you need to not just do your monitoring, also to document those particular incidents. We have compliance reporting so that you can report to boards or steering committees, audit committees, government entities, whoever it may be. We have ad hoc reporting. That's what we talked about, where it's just one click of a button to get all of your data back to you. And then, of course, we have integration with many, many systems. So chances are, regardless of the system that you're using, we can get that data into FairWarning and we can put it in a format that you'll understand. And so again, just getting the data is oftentimes one of the biggest challenges, and FairWarning, we're really the data integration experts. And then Andy, we can go ahead and advance here. And this is just an example of some of the many thousands of health systems across the globe that we partner with. Like I mentioned, really the biggest and largest platform in the entire industry, in the entire world. And again, having data from so many different organizations, so many different systems, this is really key to some of the benefits that our customers get, because the more data that we see, the more data we can use to train our algorithms. And again, the more that you benefit from really those that came before you. And then Andy, I think that's the last slide we have here before our demo. Yep. All right. So I will go ahead and take control here.
All yours, Tyler.
Perfect. I'm going to go ahead and share my window here. And I'm going to go ahead and authenticate into FairWarning. And what we'll do is we'll go ahead and go through really a platform overview. I'm going to kind of start from a privacy analyst perspective, give you guys an idea of what it's like to live with FairWarning kind of on a day in and day out basis. Now, as I'm going through this, please feel free to type any questions in to the questions, and we're going to leave time at the end of this to go through and answer those questions for you. So as I'm going through the demonstration, if questions come up, questions pop into your mind, feel free to type them in, submit those questions, and we'll get them answered as soon as we finish the demonstration here. Now, where I'm going to begin is our dashboard. So when we log into FairWarning, you can see our landing page here is our dashboard. And this is a great place to keep track of really the system progress. So how many alerts are we triggering on suspicious behavior? What are those alerts? How many investigations are we completing based on those alerts that are triggering? And what's the status of all this? Do we have alerts that are open? How many alerts are currently under review or being reviewed? What's our different ratios for incidents? All of that can be tracked and monitored right here on our dashboard. Now, what's also nice about our dashboard is that they're really easily customizable. So we can come in, we can manage our widgets, and we have a large library of pre-built analytics and widgets that you can simply put right on your dashboard by selecting pre-built widgets. So really nice that you don't have to actually build anything. There's no report building necessary. Everything is pre-built and ready to go for you. Now, I'm going to show one more example of a dashboard here because I want to show that you can actually do monitoring just kind of at a quick glance on your dashboard. So we've built out protected patient dashboards for our customers where you can monitor for certain patients that need more of a kind of a close eye on them. This can be, in this example, COVID patients. Maybe it's VIP patients. Maybe it's patients with sensitive diagnoses. Maybe it's mental health patients, substance abuse patients. And so you can see that we can set up widgets that help us to monitor for who is accessing those patients, whether it's from a department access, whether it's from an individual user access. And you can see we have lots of different ways that we can actually monitor and kind of slice and dice the different data here. Now, from here, I'm going to pivot into kind of our first use case. And what we'll see here is that this is really the most basic use case that FairWarning solves for our customers. But again, it's still one of the most common use cases. And when we talk about getting data back from many systems, I know I've mentioned it a couple of times now, but oftentimes we find that our customers spend days, if not weeks, just requesting data out of these systems to then put into a spreadsheet and have to analyze for some sort of patient inquiry, something along those lines. And so for the purpose of our demo, we're going to say that we need to respond to a patient inquiry, a patient complaint, say. And so maybe John Smithson here called in and said, hey, somebody accessed my record inappropriately, and I want you to look into it. And so all we need to do with FairWarning, again, instead of having to request something from IT, is go in and type in a date range, type in our patient name, and then execute the report. That's it. That's all we have to do to get data back from all of our different systems. Now, we also give you intelligent insights to actually visualize the data that's coming through in those systems. So it's not just returning data to you as it would in the format of a spreadsheet. We're also giving you data visualizations in ways that you can intelligently slice and dice or intelligently analyze the data that's coming through. Now, you can add as many of these as you'd like. So if you'd like to add additional insights, if you're more of a visual person, you can add as many of these as you'd like across your screen. Or if you'd like to simply look through the data and see what data we have that's pertaining to this particular patient, we can actually scroll through and scan and see, well, who accessed this patient and what was this particular user doing. Now, what you'll see here for our patient, John Smithson, is that we have a user named Jennifer Stewart, and she's accessing our patient, and she's a pediatrics medical assistant. Now, keep in mind that the department and title information typically isn't contained within your source system. This is usually data that needs to be added in after it gets to us at FairWarning from an HR system, from Active Directory, something along those lines. And we're actually doing that data manipulation for you so that, again, when you're looking at this information, you see everything right here in one single view. So again, we can see Jennifer Stewart, she's a pediatrics medical assistant. And I can also see what she's doing in the patient record. Now, we make it really easy to also see the actions that are being performed. So it's really important to know, is this user modifying something? Are they updating something in the chart? Are they sending an order? Or in the case of Jennifer here, are they just viewing the record? Are they viewing diagnoses? Are they viewing encounters, patient history? Now, in the case of John here, we can kind of further scroll over and see what's going on. Now, John Smithson, our patient who called in, he is a surgery patient, and he was born in 1977. So for the purpose of our demo here, pretty easy to see why Jennifer is not supposed to be in John's record here. She's a pediatrics medical assistant, and she's accessing the record of an adult surgery patient. Again, something we probably don't want happening within our organization. Now, the next step after we've identified something like this is to get more information on who Jennifer actually is. Many of our customers have tens of thousands, over 100,000 employees oftentimes. And so understanding who an individual is within your organization is important, and it can be challenging sometimes. Now, with FairWarning, we actually give you the ability to simply click on the name of an individual. And so I'm going to click on Jennifer's name here. And this actually pulls up what we call a user people card. Now, this people card is essentially everything that we have about this individual in one location. So all the information that's streaming in from those many different systems, again, it's our HR systems, it's our clinical systems, it's things like Active Directory, it can be cloud applications. All of that gets compiled right here onto our people card. You can see we actually have a people section here where we can search for any individual within the organization. So again, we're updating this every single day with all the information about all of our staff members. Now you can see all of the demographic information for Jennifer here, but we also have a behavior score. This is really important when it comes to monitoring for high-risk individuals. And so speaking of high risk, we can see that Jennifer here has been involved in 7 alerts in the past. She's been investigated many times in the past, and FairWarning has given her a high risk level. We can probably all agree that based on these statistics, Jennifer is a high risk individual. Now, this technology is really geared towards ensuring that we never have someone get to this point. Whenever we have customers that in the past, they didn't have a way of tracking employee or staff member behavior over time, we found that oftentimes you get people like this, where they are constantly performing actions that are high risk. They're constantly performing behaviors that are against policy or that are very risky behaviors. But if we have a technology like this, where we can actually see, okay, who are the frequent flyers maybe within the organization, who's consistently performing things that are of risk, it allows us to, again, point out those risk levels and surface individuals like Jennifer here to us before they get to this point, before they become a high risk. Now, also on our people card here is an example of the activity of the individual. So we can actually slice and dice user behavior from a graphical perspective right here on our people card. We can see things like top actions, number of patients. We can actually look at the activities that this individual is performing and in what volume. And then we can also get a snapshot of the individual's history within our FairWarning monitoring. So we have identified that Jennifer is a high-risk individual here, but why is that? And so what we can see is, well, she has a pretty bad habit, it appears, of snooping. She's snooped on other employees in the past. She's even snooped on her manager in the past. She's been flagged by the FairWarning AI technology for anomalous activity. So a lot of different behaviors here that are a bit concerning when it comes to this individual. And obviously for the purposes of our demo, we make Jennifer look pretty obvious here, but there's many examples of this across our customer base where we have people, again, who are kind of constantly performing these infractions. And again, FairWarning can point those individuals out to us. Now from here, I'm gonna pivot into our report center very quickly. Want to make sure we leave time for questions at the end. So I'm going to jump into our report library, kind of fast forward a bit. And what you'll see with our report library is that we have pre-built analytics that are ready to go out of the box on day one. So all these behaviors that we've talked about so far, the snooping behaviors, the AI that we can monitor for anomalous behaviors, all of these different analytics are actually pre-built for you on day one, so that if you say, hey, I want to monitor my cloud applications, or I want to monitor for administrative activities, all of that can be done on day one without having to actually build or tune anything. And we have hundreds of these analytics that are available really right out of the box on day one, ready to go. Now, what happens when we take those analytics and we enable them to run on a proactive basis? Well, they trigger alerts. And so I'll go ahead and click into our alert center. And what we'll see is that we have a couple different behaviors here on the left side of our screen. So we can see that we have some coworker snooping, some users modifying their own records. That's one that's really common. We have trending analytics looking for things like printing, high exports, things like that. We have abnormally high access. And I'll go ahead and click into one of these alerts to show you what they look like. So we'll go ahead and click into our high face sheet printing analytic here. And if we click into the details, this will make a lot more sense when we actually show the graph here. But we can see that we have a user named Darren Arison, and Darren is being flagged for printing of a high number of distinct patient face sheets. So FairWarning can actually trend individuals and point out risky behaviors when they happen in a certain volume. Now, if we take a look at our alert events here, what we'll see is that FairWarning gives us a graphical representation of what's actually occurring and why we need to be concerned about it. So it gives us different benchmarks and different statistics, so we can see, well, on this particular day, this is very abnormal. This is an individual who has accessed and printed a very high number of patient face sheets compared to both his normal daily access and the access of his peers. So he's doing this in a very anomalous manner here, something that we need to look into for sure. Now, when we talk about needing to look into something, needing to document some type of access, that's where our investigation module comes in. So I'm going to go ahead and click into our investigation module. I'm going to go ahead and type in Darren here. So we'll stick with our individual Darren Arison, who was flagged for the printing infraction there. And we can see that we have a fully documented investigation for Darren here. So what happens is FairWarning is able to extract the data out of our proactive alerts and then actually place it into a fully documented investigation. So that way we have everything covered from really A to Z when it comes to complying with regulations where documentation is really key. We have our name and description. We can fill out risk assessment scores or risk assessment forms. We can document many different types of investigations. So they can come from automated alerts and FairWarning, but they can also come from other types of areas. So they can be complaints, it can be IT incidents, loss of information, improper disposals, thefts of information. It can even be other, it can be anything really. And we can use this FairWarning investigation module as our organization's central repository for investigation management. And you can see we also have details of the incident. We have a custom section that'll be built specifically for your organization. We have important dates. And we also have a note section, and this note section comes in handy for keeping communication central. So obviously we don't necessarily want emails floating around when it comes to investigating inappropriate access. We want to keep everything in one central location. So we can use our note section to securely communicate internally and collaborate on this investigation so that we keep all of our communication right here in one location. Now, we also have other sections here within our investigation. So you can see this is very comprehensive. We have a forms section where we can fill out forms, whether it's internal HR forms, whether it's, again, risk assessment forms. We can do all of that right here in our investigation. We have involved parties that'll be documented. So everyone that's involved in this, whether it's patients, it's staff members, even reporting parties, can all be documented here right inside of our investigation. We can attach reports, we can attach events, and we can attach documents as well. This is really important. So if we do have emails that need to be uploaded, if we do have external information that pertains to an incident or pertains to an investigation, we can upload and attach that right here within the FairWarning application. We can attach alerts if this stems from proactive monitoring. And then we have a resolution section. And the resolution section is key to really closing the loop when it comes to our investigation process. So this is where we can come in, we can mark our investigation as either with or without incident. We can customize and select incident levels. We can also apply corrective actions here. So we can see, well, maybe this employee received a verbal warning or a written warning. We can document response action. So how do we respond to this? Maybe we sanction workforce members. We can put resolution notes in here as well. And so you can see if there's ever an audit that takes place, if there's ever an inquiry in the future into, well, how did we respond to something? All of that is contained right here and saved in FairWarning forever so that we can see exactly how we responded to an incident and evidence how we responded to that incident from a compliance perspective. Now, lastly here, speaking of from a compliance perspective, we have our governance module in FairWarning. And this is really a great place to evidence the effectiveness of our monitoring and evidence the monitoring that we're doing day in and day out. So obviously we want our customers to get credit for what they're doing every day. And so with our governance module, we can run reports, and these are all pre-built and ready to go to show the effectiveness of our program. Maybe it's just, hey, how many alerts are we triggering? You can click alerts for the last week. This will give us a chart of all the different alerts that have triggered. You can see we have 72 alerts that have been closed, a couple with investigations open, a few that are under review. And this gives us a status update, whether it's C-level individuals that are asking, hey, how's your FairWarning program going? Or again, maybe it's governing bodies or auditing committees that come in and want to see statistics on your program. So that really covers kind of a high-level tour of the FairWarning application. Those are really the high-level modules that our customers are using day in and day out. You can see we've covered everything from our dashboards. We've covered our reactive monitoring with our quick reporting functionality here. We've covered our people cards. We've covered our report library. I've showed an alert. And then we've also showed the investigations and the governance module. So I know that's kind of a quick demonstration there, but that's really a high-level tour of the FairWarning application. So from here, I'm going to go ahead and turn it back over to Andy. And Andy, I think you're going to cover any questions that we have received.
That's right. Thanks, Tyler. That's phenomenal. And let me just click on the slide.
Andy,
Derek, can you click on one slide?
Yeah, I'll do that.
Thanks. I just wanted to follow up what Tyler, I mean, firstly, fantastic demo, Tyler. Thanks very much. Great to see the product and how powerful it is. I'd just like to close that out by saying that we have FairWarning in numerous NHS trusts already. It's being used really effectively. We have a great case study on our website which talks a little bit about some of those trust and privacy challenges that were addressed by using FairWarning, and I think it's really, really great to see how well it's been proven in the NHS already. Obviously, and thanks to everyone for attending. We will do some questions now. If anyone does want more information or to follow up offline, first port of call is Andy and the team at IT Health, who can ensure we've got the right people in Imprivata's side to support Andy's team on talking to you about the benefits that FairWarning can bring.
Yeah, thank you, Andy. Yeah, it's Andy Sherritt here again. Thank you, Tyler, for an excellent demo. So yeah, there's a little bit of time left still if anyone's got any questions. I've been monitoring the question panel as we go through. We do have one, Tyler, which I'll throw at you if you don't mind. It's to do with data recovery. So the question is, you say that you can recover data. How is this? And does it delete data in the system it's discovered from?
Yes, that's a great question. And really the answer is it's really up to the customer. So we'll establish a data retention strategy during onboarding where we decide how much data historically do we want to ingest, how much data do we want to retain, and how do we want to retain that data? Do we want to archive that data and compress that data, or do we want to leave that data live in your cloud environment for reporting just at the click of a button? And as far as deleting data goes, or purging of data, as we call it, totally up to you on that strategy. Do we want to purge data after we've examined it, or do we want to leave it live in a secure format for reporting at a later date? So totally customizable as far as how that strategy goes.
Yeah, thank you, Tyler. Jane, I hope that answered the question. Obviously, feel free to follow up with me afterwards if there's anything more that you need on that. So yeah, oh, there's one more question just come in. Legal basis for monitoring. That question's come in from David. I'll just read it. From Roy Underwood, legal basis for monitoring. So I guess that's around, yeah, is that any issues there, Tyler, that you're aware of?
No, so all of the, from a data protection perspective and a data retention perspective, data always resides in region. So from a legal perspective, FairWarning, having your data, anything along those lines is covered. You own the data. The audit logs are stored in region. They're your audit logs, it's your data. And then from kind of a legal perspective of the monitoring that we do, we always perform a policy review during our customer onboarding to ensure that your internal policies support the monitoring that we're going to be doing with the FairWarning application. So we really cover the kind of the full legal spectrum during the onboarding to ensure that, again, you're covered from both a policy perspective and from a regulatory perspective.
Okay, thanks, Tyler. Another question, thank you, Andrea. Can the QAM be configured so we don't have to change it every time we use it? And can the date format be changed to the UK date format?
Yes and yes. So we can ensure that it's configured and kind of stored in a manner where you don't have to make any changes. Everything is just automated. Now, if you want to make a change, you certainly can, but typically we'll go ahead and automate everything so that everything just kind of occurs on an automated basis without you having to change things or change formatting and things like that. Automation is definitely a big part of the onboarding.
Okay, thank you. Thanks everyone for the questions. I think that's everything we've got for now. So yeah, thanks everyone for joining the webinar. As I said, we'll follow up with a recording of the webinar. So we'll send that through to you by email in the next couple of days. Immediately after you exit the webinar, you'll be served a survey. Be very grateful if you'd complete that just for a bit of feedback. And yeah, thanks everyone for attending. Bye for now.
Thanks, bye.